Hi, everyone, and welcome back to another episode of Mindful Marathon Conversations. I'm your host, Dr. Michelle Quirk. I'm a pediatrician and a run coach and the founder of Mindful Marathon, where I help make running easy and fun for busy professionals. And today I have a very special guest with me. I have a colleague in medicine, Dr. Sumana Moole. And she is a GI doctor, and let her introduce herself further and we'll get into it. So Dr. Sumana,
Thank
welcome
you.
to the show.
Yeah, thank you, Michelle, for having me. Yeah, it's funny when we were chatting just now, we found out we both went to the same med school, Hershey, Penn State University at Hershey Med School. And the same years too, 2005 to 2009. That's amazing. What a small world.
Yeah.
But yeah, I'm here in gastroenterology private practice at Merus Gastroenterology and Gut Health outside of Atlanta, Georgia. We focus on not just a 360 degree view of the gut disorders, not just curing, but also improving the gut health and prevention of GI related disorders. So we aim to help people thrive through helping them achieve their best gut health. Yeah, happy to be here and happy to chat with you.
Yeah. Thank you for being here. We were talking beforehand. I was telling Dr. Sumana about all of my issues with the gut and running and the common questions that I often get from my runners. So we'll kind of talk through some of those. But I think maybe, to start, maybe can we talk about how running is good for the gut? We'll start with that.
Yeah, absolutely. Yeah. So yeah, running is a form of exercise. It's an aerobic form of exercise, right? So tremendous benefits from that perspective. There's number one is bloating and constipation. When we move, the mobility of the body helps the gut move. So the gut moves with you. And so when we move, the bloating is decreased as well as constipation is relieved. IBS symptoms, especially the constipation predominant IBS, we see improves significantly with running, the endorphin release, the resetting of the hormones as well. Even including IBD, which is inflammatory bowel disorders like Crohn's, colitis. Uh, People who run regularly, who exercise regularly, have much less frequent flare-ups than those who are more sedentary and do not have exercise in their protocol. Along with that, acid reflux is a big back and forth. We'll talk about the other side, but the benefit of running is long-term running seems to actually help with managing acid reflux and decreasing acid reflux episodes. Probably some of the mechanisms could be that it improves the motility of the gut even after you're done running. And so there is not as much reflux and there's antigrade or peristalsis and refluxing back up.
Yeah.
The motility increases. So that's one. And there's a few more. Non-alcoholic fatty liver disease or fatty liver is quite a common cause of inflammation, sometimes even cirrhosis of the liver. Exercise, running is a great way to lose weight and decrease the fat content of the liver. So yeah. And then colon cancer. So colon cancer is the second common cause of cancer, and there's very strong evidence that running and exercise decreases the incidence of colon cancer.
Oh,
So this is,
wow.
yeah, there's quite a few benefits. Yeah, keep
Yeah,
running.
I know, right? I guess I was unaware of all of those associations, really. I mean, it sounds like it helps almost every common, GI condition that I would think of. It
Yes,
is a
it
help, which
does.
is great.
Yeah, yeah.
And I've noticed some of those things in my own running. I guess one question that I get a lot, and we were talking before, is timing of eating maybe around a run.
Mhm, mhm.
And I always tell my runners, like, we're all sort of an experiment of one, and what works for me may not be the same as what works for you, and it's a little bit of an experiment. But and maybe you could give us your advice on maybe timing eating if you're
Right.
going to, or running on an empty stomach.
Yeah, absolutely. So I think running is especially the long runs, probably the fueling is a prime thing, as you know, with your running experience and your coaching experience too, the pre-run fuel and how you actually give yourself the fuel during the run and after really matter in terms of what symptoms happen. The most common symptoms we hear, and some of the folks in our patient population that run are having bloating, increased acid reflux, feeling that sloshy stomach, nausea, cramping, needing to run to the bathroom once maybe they start running, and this uneasy, queasy stomach, and what to do with them. Some of them may be related to nutrition before the run. If they have something high in fat or sugar before the run, too close to the run, that might upset their stomach and they might have these symptoms. If they're relatively empty or train the gut appropriately and have foods that are more rich in carbohydrate, but start slow and then train yourself to where you're able to tolerate more, might be another way to train the gut. Did I answer your question, Michelle?
Yeah, I think so. I mean, it sounds like even with marathon training, not only are we training our hearts and our legs and our minds, but we also have to train the gut to be able to accept the fuel along the way.
Exactly. Yeah.
Yeah, usually my advice for everyone, we start out with something and then just kind of experiment, right? Because we have to try something if we're going to be out there for more than 90 minutes. And
right.
Some people like the gels and very, very, very sweet. Other people like to try more like whole foods or dried fruits or things like that, but they affect everyone differently. When one person may get a feeling like they have horrible reflux, another person might feel like they have to run to the bathroom. And if you've been running long enough, you've probably had all of those experiences at least once or twice. But it's interesting that everyone is different and everyone's gut is different.
Yeah, absolutely. Yeah, those gels. Yeah, I was reading that these are they're highly concentrated sugars and carbs, trying to give you more calories in a quick bite, but then they're very osmotic, right? And then they make the gut release a lot of fluid to counteract the highly osmotic gel that goes in, and then that causes probably sudden changes in the gut motility and the symptoms that are associated with it. So I guess if gels are causing it, maybe diluting it with maybe just sips of water and making it less concentrated, maybe one way to deal with that. But yeah, a lot of experimentation and going slow seems like the way to go.
Yeah, there has to be enough water around, right, for you to absorb all of that. So, but it is hard to, especially, as you're running longer, sometimes you're really not wanting to take in very much. It's one thing to be thirsty, but to try to kind of like force in a gel and then water, and then you get that sloshy feeling like you're talking about. So this is, it's tough, but we figure it out for each runner. But I think the important piece is that everybody is different.
True. Yeah, absolutely. Yeah.
I guess on that same topic, would taking probiotics help, or if you are a regular eater of yogurt and things like that, would that help in the running sense? I'm not sure if I've
that's a very good question. Probiotics is whole topic in and of itself, but if they're eating, I guess if they're consuming a regular standard diet with some fermented foods, then you're already at a balanced microbiome, gut microbiome, and addition of additional probiotics may or may not have a beneficial effect, especially in improving the performance, so to say. But if someone doesn't consume that many fermented foods, or they're exposed to a lot of antibiotics, medications, recent changes in gut health, as in like diarrhea or inflammation, they might benefit from adding these some probiotics. or even just adding fermented foods like kombucha, miso, and yogurt, those sort of things regularly in the diet as well. But running itself, the activity of running and physical exercise changes the gut microbiome to increasing the more good beneficial bacteria and less harmful bacteria in the gut. So there's a whole host of studies that show, even in mice that are made to work out exercise and those that were sedentary, the bacterial colonization is very different. The species are very different from one to the other.
Wow.
So there's less inflammation and more good bacteria with continued running or exercise.
Oh, wow. That's
So
really
probiotics,
interesting.
yeah, in some subsets, yes, but not, maybe not that useful in everybody.
Yeah, I didn't know that about the bacteria. See, I'm learning so many things.
Yeah.
You're making even more of a case for why running is good exercise.
Absolutely. Oh, yeah. Anytime.
We'll keep our GI doctor happy too.
Even for
Anything?
sleep, right? Yeah. The
Oh,
more you run,
yeah.
exercise, yeah, sometimes you're used to it. You don't go for a run, you can't sleep at night. So it's like, the things that you have to do to get a good night's sleep.
Yeah, it's that balance of
Mhm.
activity and rest, I think.
Yeah. Yeah.
Well, is there anything else, any other GI related topic to running that we didn't touch on that we should before we go?
I think, yeah, we touched on everything. The most common things, of course, that I hear are the cramps that you get once you start running. What do you do? It's the same thing, not eating too close, eating smaller meals, maybe 30 minutes before, start small, like maybe 20 grams of carb, maybe half a banana, and then build up from there. And then if there are cramps, slowing down the running pace, and some of the cramping could also be from decreased gut circulation, or splanchnic circulation, decreased blood flow, because most of the blood flow is now going to the muscles, making sure they're hydrated properly before the run itself, and then slowly hydrating during the run is probably essential to minimize the symptoms as much as we can. So yeah, timing of the fuel, pre-run fuel, and when this happens, maybe slowing down to a jog or a walk during the run until the stitches go away, and then keeping up with the hydration, are all probably essential things. And one other thing is to avoid high fat and high sugars, high fiber too, and the largest meal before the run, even if it is the night before the run, then decreases some of these symptoms. So
Yeah.
yeah.
This is great advice for all of our long runs coming up this weekend. So
Oh, good. Where are you
thank you.
going? Uh-huh.
No,
Absolutely.
you know what? I'm training for a half marathon that's in April.
Okay.
So the long runs aren't too long yet, but
Mhm.
yeah,
Mhm.
maybe when this comes out, the long run will be longer
Cool.
in a
Yeah,
few
that'll be
weeks
a
from
good
now.
time. Yeah, April is a good time, springtime, and it's nice to be outside. Yeah,
Yeah.
absolutely.
Yeah, it's
Yeah,
a little tough right now with the cold weather, but we're
yes.
making
Yes.
it through.
Yeah. We're almost there, right?
Yeah.
We're into February. Oh, yeah, that's
Yeah.
right.
Oh, well, tell everyone where they can find you, especially if they are, in the Atlanta area.
Absolutely. Yeah. So we're in Johns Creek, Suwannee area, physically located here, but merusgastro.com is the website. And then also, same thing, Merus Gastro is the handle for Instagram. And same thing for the YouTube channel as well. But yeah, happy
All
to
right.
answer any questions, anything else that comes up as well.
Yeah, thank you so much. This has been very, very educational, and I definitely learned a lot. I hope everyone out there listening has learned a lot too. So thank you so much for joining us.
Absolutely. Thank you for having me. It was fun.
Thank you so much for joining us for this episode. If you liked it, please subscribe and share it with a friend. And if you are a newer runner or a runner who hasn't run in a while and you're looking to get back into the sport, you can find out how to work with me over on my website, which is mindful-marathon.com. See you on the next episode.